Well, good morning, everyone, and thank you, Chris, for the kind introduction and for everything you and the team at CPI Health do for families in Whitby. Your efforts to deliver a wide range of healthcare services have helped countless Ontarians recover from injuries, get back to work, and continue to enjoy time with their loved ones. Thank you so much. Now, it brings me great joy to be here today to welcome Minister Elliott and Minister Bethlenfalvy to share some exciting news for patients, families across Ontario, including those here in our community. I would like to now pass it over to our Deputy Premier and Minister of Health, the Honourable Christine Elliott.
Well, thank you very much, Lorne, and good morning, everyone. It's always great for me to be here in Whitby, but especially today, alongside Minister Bethlenfalvy and MPP Coe, to share some wonderful news about our government's significant investments in home care. I also want to thank Chris Wilson with CBI Health and everyone at CBI Whitby for welcoming us today and for everything that you do to support and provide exceptional care to clients, patients, and families. Your compassion and dedication to your clients and families is truly remarkable, and we truly appreciate the difference that you make in the lives of Ontarians each and every day. Now, long before any of us had heard of COVID-19, I think it's a distant memory for many of you, it certainly is for me, but long before that, our government made a commitment to end hallway health care. And the last 2 years have only reinforced the need for a stronger, more resilient healthcare system. An important part of our plan is to ensure that patients get the right care in the most appropriate setting. And that's why I'm very pleased to announce that our government is planning to invest $1 billion more over the next 3 years to further expand home care in Ontario. This is fantastic news, and this funding will expand services while recruiting and retaining more home care workers. Home care plays an important role in the lives of nearly 700,000 families annually across the province. Home care provides personal support services, nursing, and other professional services to seniors and people of all ages who need care to stay at home or to recover from a hospital stay. This investment will not only allow patients to receive the care they need in the comfort of their own home, but home care also helps to reduce pressures on other healthcare settings. It helps to prevent unnecessary hospital and long-term care admissions and shorten hospital stays, ensuring beds are available for the people who need them most. Expanding home care is another way our government is bolstering Ontario's plan to stay open. In addition to this critical investment to expand home and community care, the province is also providing a modernized framework for the delivery of home and community care by Ontario health teams, with legislation and a first set of new home and community care regulations being proclaimed into force on May the 1st, 2022. Through Ontario health teams, different healthcare providers work as one team to provide better integrated and more coordinated care throughout each step of a patient's healthcare journey. And this new framework for home and community care will help improve the patient experience, better connect care, reduce wait times, and end hallway healthcare. Just as our government continues to add more hospital beds and make record investments in hospital infrastructure, we are firmly committed to ensuring that patients and seniors get the appropriate care and supports they need in the comfort of their own homes, which is where they want to be. By continuing to make key investments, supporting our frontline healthcare workers, and working with our sector, we are once again taking important steps forward to build a stronger, more resilient healthcare system for all Ontarians. So thank you again for joining us today, and I would now like to invite Minister Bethlenfalvy forward to please say a few words.
Well, good morning, everyone. It's great to be here, and thank you, Minister Elliott, and thank you for your leadership. You have steered us through the last 2 years of a once-in-a-generation pandemic. You've transformed our healthcare system and led the charge to expand our capacity by building thousands of new hospital beds. You will leave behind an incredible legacy, and it has been an honor to serve with you at the cabinet table. So thank you, Minister Elliott. I also want to thank Chris Wilson and the entire team at CBI Health for hosting us today and for providing high-quality care to the people of Durham Region. And finally, I want to thank Ms. Sue Vanderbent, CEO of Home Care Ontario, for joining us today, and of course MPP Coe for his continued leadership and advocacy on behalf of the people of Durham Region. Later this week, I will be releasing the 2022 budget, and I'm looking forward to sharing our plan for rebuilding Ontario's economy, our plan for building highways, for building transit, for building hospitals and other key infrastructure, our plan for keeping costs down for Ontario seniors and for Ontario families, and how this government and Premier Ford will get this done for the people of Ontario. And an important pillar of that plan, as Minister Elliott just highlighted, is a plan to stay open, with a healthcare system that supports seniors so they can stay in the comfort of their home longer. Ce plan repose dans une grande mesure sur notre plan pour rester ouvert. Un système de santé qui soutient les aînés afin qu'ils puissent recevoir des soins et rester plus longtemps dans le confort de leur foyer. By investing $1 billion over 3 years for home care, in addition to the over $500 million we announced in our 2021 fall economic statement. Our government is making unprecedented investments in Ontario's home care sector so they can further expand services, train and recruit workers, and deliver the quality of care that Ontario seniors and patients deserve, while alleviating unnecessary pressures, as Minister Elliott highlighted, on our hospitals and helping keep our province open. Home care is a core part of our plan for supporting seniors at home. Another is helping keeping costs down for seniors and their families looking to make upgrades and renovations. That is why our government created the Ontario Seniors Home Safety Tax Credit for the 2021 and the 2022 tax season. This tax credit provides 25% of up to $10,000 in eligible expenses to help cover the costs of handrails, stair lifts, and other modifications to make their homes safer, while providing up to $2,500 back in the pockets of eligible seniors every single year. So combined with our investments in home care and other supports, no government has done more in Canada than to support Ontario seniors and help them stay in the homes that they love longer than this government. I look forward to having to say more about how we will support seniors when I release the government's 2022 budget later this week. It will be a plan that ensures Ontario stays open, by training and hiring thousands of nurses and personal support workers, by shoring up domestic production of critical supplies, by building 30,000 long-term care beds, and by building 3,000 new beds over 10 years through more than 50 major hospital projects. It will be a plan for building a stronger, more resilient healthcare system while helping to keep costs down for seniors in Ontario. And I'm very excited to have this opportunity to say more in the days ahead. In short, we are getting the job done. With that, I would like to invite Chris back to the podium to say a few words.
Thank you, Minister Bethlenfalvy. This is truly wonderful news for the hundreds of thousands of people who rely on Ontario's home care system every day. These people are our grandparents, parents, our children, our friends, and our neighbors. They are seeking home care to meet a broad range of healthcare needs: rehabilitation, post-surgical care, end-of-life care, services that support them and their caregivers to live safely and with dignity in their own homes. The common denominator is that home care keeps people out of our acute care settings like hospital and long-term care homes unless they absolutely need it. It is a much more affordable way to deliver health care, and it is also what people want. A 2021 poll showed that 91% of seniors would prefer to age at home for as long as possible. Sadly, today too many people are not able to receive the home care they need. We have spoken openly about the problems COVID-19 has caused in our sector. Those problems, particularly our staffing crisis, have impacted the reliability of home care. With today's historic announcement, government is taking a major step to stabilize home care. This will have enormous benefits to the healthcare system, freeing up hospital beds and taking pressure off long-term care homes. It will help retain and attract new frontline home care workers, many of whom left our sector during the pandemic. But patients are the real winners in this announcement, the hundreds of thousands of people who are able to receive care where they want it, in the comfort and safety of their own home. I want to say a huge thank you to Deputy Premier Elliott and Minister Bethlenfalvy for announcing this desperately needed funding and for doing it here at CBI Health. Thank you.
Thank you. We can kick it off with questions. If any reporters have a question, one question and one follow-up.
Morning, everyone. I have a question from my colleague at Global Toronto for Minister Elliott. So the NDP's platform launches today and will include a plan to hire 10,000 new personal support workers and to commit to hiring other healthcare staff. How is the PC platform going to address increasing staffing for PSWs above the current numbers?
Well, we're already doing it. We've already made a number of announcements in that respect, that we've stabilized the wage rates for PSWs, increased the numbers for them. We're going to bring another 8,000 workers, PSWs, online. We also have the rates that we're, the retention bonus that we're paying to nurses, $763 million, as well as we've got the increases for planning to have nurses that they can be compensated for their training costs if they go to work in an underserviced area of Ontario, which is another one of our concerns in rural and northern Ontario. So we're already taking all of those steps, and I know that the NDP is making these announcements, but you can't just produce 30,000 nurses out of the air. They have to be trained, and we have a plan to do that.
And if I can maybe add, I'll just add as well, you know, the minister is absolutely right. We're actually doing it right now. We're not talking about it. We're actually doing it. And if I would just add, with regard to the long-term care sector, we've made a commitment to hire 27,000 nurses and personal support workers in addition to the hospital and healthcare sector and home and community care. So I know I put aside $4.9 billion to fund over the next now 3 years, because when we did that announcement a year ago, it was 4 years. So we're not only building physical capacity and investing in our hospitals and our healthcare system, we're actually hiring, training, retaining, motivating, and compensating people in our healthcare sector, not just for today, but for tomorrow.
Okay. Thank you.
Do you have a follow-up? Any other questions? Otherwise, we're good? Okay, thank you. If we could just stay behind for a group photo.
Thank you.